Good morning, everyone. Welcome on in. Today we have our Workforce Wednesday webinar with some lovely presenters. We're going to be going over navigating the maze and challenges and successes within healthcare career pathways. Before I pass it on over, I do have a couple of housekeeping pieces that I want to talk about. So number one, my name is Mikhail English. I work at ICSPS. I'm a Workforce Innovation Coordinator. Today I'll be your moderator and tech support. When it comes to the webinars, so if you're looking at unmuting or turning your camera on, just know that the way that our webinars are set up, we'll direct all of those questions to the Q&A, and if we want to come off mute at the end, you can just raise your hand and I will give you the ability to unmute. In addition, this webinar for accessibility purposes will be recorded as well as closed captioning is available. If you're wanting to access closed captioning, go to the bottom of your Zoom bar. There will either be a CC kind of emblem or there'll be the three dots. You can click those three dots and find your closed captioning there. If you're wanting to go and look at the recording, you can go to the WIOA Professional Development website. I'll send that in the chat in a moment and get this recording as well as any materials and resources used today. The last bit that I have for you guys is actually our standard Workforce Wednesday webinar polls. So in a moment, two polls will pop up on your screen. If you can take some time to answer those. So number one, what partner do you represent? Love it, I'm seeing some answers already. Number two, where is your local area? Seeing a lot of central and northern, a little bit of Chicago. Again, number one, for the polls that are up on your screen, what partner do you represent? And two, where is your local area? Got a few more people. I'll wait a little bit longer. Thank you for taking the time to answer these polls. I know we're getting settled on in with our Zoom here this morning. All right, I'll share these results for you all to see. So we're seeing a lot of Title I and Title II, a little bit in other WIOA partners and stakeholders. In our local area, that Northern Illinois is coming in strong with Central and Chicago coming in back. So thank you guys so much for doing those polls. We'll have another poll throughout our presentation, but without further ado, I will pass it off to our lovely presenters. Thank you.
Thank you, McCall, and welcome everyone.
Hello, everyone. Welcome. As Mikhail shared, we are here to present on our recent research study, Navigating the Maze, Challenges and Successes in Healthcare Career Pathways. My name is Izifrata Sasahule. I'm a program manager at Women Employed.
And my name is Tara Driver. I'm the Senior Career Pathways Manager here at Women Employed. And so today we're going to tell you a little bit about Women Employed. We've been building over 50 years of progress to create a better future for low-paid working women. Since 1973, Women Employed has worked to improve the economic status of women and remove barriers to economic equity. And we seek systemic improvements that touch the lives of women in low-paid work and women of color, particularly Black and Latinx women. The way we approach our work is by ensuring appropriate compensation, paid leave, schedule flexibility, fair workplaces, and enforcing all of these things that make quality jobs. We also forge education and career pathways to economic security, leadership, and wealth, and we shift resources distribution to empower women economically. And we do this unapologetically. And so the reason why we are here with you today is that evidence that women, particularly women of color, have challenges advancing lots of attention to healthcare career pathways. We see that the problem is a growing focus on healthcare career pathways, program initiatives that focus on getting women in the door, Black and Brown women in entry level positions. But the problem is that they end up staying in those positions, even though their goal is to move up and eventually maybe go into the medical field as nurses. Um, so women of color are overrepresented in entry level healthcare jobs, and they seem to have a difficult time advancing. And so our goal with this research project was to find keys to career pathway successes.
And we are excited to share the findings from our research study with you today. But first, we'd like to just give you an overview and a sense of what went into the project, which included 6 components. We conducted a literature review to learn from existing research on healthcare career pathways for entry-level workers. We partnered with the Workforce and Organizational Research Center to do a Chicago healthcare workforce scan. We also did an upskilling landscape scan to discover what types of upskilling programs were available for entry-level healthcare workers in the Chicagoland area. We held monthly meetings with partners to inform the development and interpretation of the study, which we'll talk more about in the next slide. We did our interview study, with the findings of which will be the focus of today's presentation. And finally, we met with several subject matter experts, healthcare educators, workforce development specialists, union representatives, to help answer questions that arose during the study and help inform our thinking.
And so these are the list of our partners that we work closely with on this project. Um, Chicagoland Healthcare Workforce Collaborative, Esperanza Health and Medicine Policy Research Group, Instituto, and Westside United. And what we did is we met regularly with our partners to share insights, to share knowledge, to share maybe previous research done on this particular topic. They provided input on a lot of our assessment questions and a lot of our research questions. They reviewed drafts of the research, of the analysis, and of the language. And they actually helped shape the recommendations that came out of this research that we will discuss a little bit later in this presentation.
For the research study, we interviewed a total of 44 participants. All participants identified as women, and over half mentioned that they were parents. The majority of participants were women of color, with 43% identifying as Hispanic or Latina, 32% identifying as Black, 14% identifying as white, 9% identifying as Asian, and 1%, which were other unknown. The age range of participants was between 20 to 59, with the large majority being between the ages of 20 and 39. Over half of our participants started as either a certified nursing assistant, a patient service representative, or a medical assistant. Approximately 45% were in nursing, including a few who are currently enrolled in a nursing program. The years of experience in healthcare ranged anywhere from 2 years to 31 plus years. And we talked with workers at multiple institutions across Chicago, including 9 health system hospitals, 3 health system clinics, 6 federally qualified health centers, 1 nonprofit clinic, and 1 specialty pharmacy. So we'd like to start off before we share our findings to ask you a question. And Michaela's going to put up the Zoom poll for us shortly here. But the question is, what do you think is the most popular healthcare career pathway? Is it A, certified basic nursing assistant to registered nurse, B, patient care representative to clinic manager, C, medical assistant to physician's assistant, or D, receptionist to laboratory tech? So I'll give everyone a moment to take the time answering this question. And then once we have all of our answers in, Michaela will share the answers with all of us.
I'll give about 5 to 10 more seconds and then I'll share those answers. And here are those results.
Oh, wow. So 100%. Everyone thinks that the most popular healthcare pathway is from a certified nursing assistant to a registered nurse. All right, well, thank you so much for participating in our poll. Um, and the answer is, drum roll, please. This is actually a trick question. We did not find a most popular pathway. Though all of the above are possible, we found that there were many different pathways and often not what we might expect. So we'll be sharing more about this in the coming slides.
Yes. So that was a trick question. And as Afrada said, our goal was to find keys to success in terms of career pathways, what keeps women from advancing, and what challenges they have to overcome. But as she mentioned, instead, we found a confusing maze of endless options, education and training, different types of programs and certifications, job titles, non transparent employer practices, meaning there's insider information. You know, some people got information and some people didn't. And the need for mentorship and racial discrimination was a key factor in people being able to get the resources to move up. Also, a lack of alignment between what workers, education training providers, and employers see as a pathway to success. There's also a need for mentorship that we found workers express. They express the need for people to have an investment in their professional development and their career pathway choices. And then we also found that workers experience racial discrimination. It was especially prevalent as we spoke with workers who were have backgrounds that were Black women. Um, most of them mentioned racial discrimination as they were trying to move up in their career pathway. Next slide.
So, one of our overall key findings from the study is that healthcare career pathways can be meandering, largely due to the extremely confusing system of schools, employers, and bureaucratic process that makes career pathways murky and difficult, if not impossible to navigate for the workers we spoke to. This contradicted many employers and training providers' beliefs that healthcare career pathways are clear. However, workers shared that the lack of alignment between credentials earned, hiring criteria, wages, year of experience, and promotional opportunities creates confusion about what is a realistic healthcare career pathway. Additionally, what employers say or what is in writing about who they hire and what criteria are required for jobs is often not always reflected in their search and hiring practices. We also found that there is a plethora of job titles for the same or similar work. This graphic represents the job titles our participants held past and present. We found many different job titles for the same or similar work, as well as similar titles for different work. This often makes it difficult to compare wages across employers and distinguish between roles with equivalent responsibilities. Additionally, we heard from union representatives that sometimes employers created different job titles for similar work as a strategy to skirt around union rules. Participants took surprisingly diverse healthcare educational paths, some of which were not always intentional, and many had multiple credentials, some perhaps unnecessary. Workers were confused about which credentials were the best fit for their desired career path. Many students were unclear about accreditation and licensure, etc. When choosing schools, they often just chose what was convenient based on geographic location or referrals from a friend or family member. And sometimes they received inaccurate information. There was also confusion over which nursing credentials are the most important or were the best stepping stone to eventually becoming a registered nurse. While we heard from educators and employers that the bachelor's in science in nursing, so the BSN, is the desired RN credential, many participants shared that they were satisfied with their associate's degree. And additionally, the medical assistant to nursing pathway was a popular desired path, but particularly problematic to achieve in terms of time and prerequisites needed to transfer from medical assisting into nursing. The COVID-19 pandemic exacerbated problems with inconsistent healthcare hiring practices, such as inconsistencies in accepted credentials. Earned credentials were not always in an upward trajectory. For example, there are many folks who would go on and get their bachelor's degree and then go back to obtain a CNA. The lack of guidance resulted in educational paths with many twists and turns that often took a long time with work in between or other gaps in education for various reasons. So we created a series of graphics to further illustrate the different education and career paths our participants took. And you'll see on your screen, participants who started as medical assistants had a wide variety of pathways that followed either a clinical or administrative route. So this could mean someone starting off as a medical assistant and then going off into a supervisor or manager role, more of an administrative position within the clinic. Or they might go down a clinical pathway. And as you can see, there were folks that did go on to get to become registered nurses. Similarly, participants who started as certified nursing assistants also took various pathways, some of which were non-nursing, such as going into public health or working in health IT, and others who went down what we would expect to be the more traditional pathway for CNAs to go on and become nurses and have supervisory roles. And you can see here, there's also this two-way relationship between folks who started off as MAs and wanted to go into nursing, or folks who started off as CNAs and then end up becoming medical assistants and work in a clinical environment also, or in a clinic environment. And then when it came to workplace environment and hiring and promotion largely depended on who you know and connections you have, regardless of credentials and years of experience. Workers were often hired initially because they knew someone or were related to someone to get their foot in the door, even at entry level. Particularly at hospitals, workers said that application systems screened them out unless they had someone to intervene on their behalf, even if they did have prior credentials or experience and were qualified for that position. There was also a difference between hospitals and clinics. There was a clear difference in opportunities for and ease of advancement between hospitals, which tended to be more difficult, and federally qualified health centers, which tended to be more easy. Hospitals were seen as the best place to get exposure to a wide variety of careers and medical specialties, which made them especially appealing for individuals earlier in their career. However, largely due to the siloed nature of hospitals and bureaucratic application process, some participants shared experiences of struggling to secure positions across departments within a hospital system. Individuals who worked in clinics or smaller hospitals, on the other hand, expressed feeling supported by their managers and developing closer relationships with colleagues who mentored them. When it comes to this various support and barriers to career advancement, workplaces that supported employees in their professional development were particularly important in helping workers persevere through schooling, but also personal life challenges. And this included flexible work schedules and tuition support. School wraparound services and supportive staff were key to retention and persistence, particularly test preparation, study groups, career guidance, and placement, and on-site childcare. Family and friends also provided emotional and financial support and helped balance caregiving and household responsibilities. When it came to barriers, geographic location was a barrier in terms of commuting distance for school, clinics, and/or work, often limiting healthcare workers' choices. Childcare was a particular challenge for women, both when attending school and working, and many women did not know about or were unsure who to ask about available resources to support their career advancement related to school, professional development, or workplace rights. Almost all of the women we spoke to worked while going to school as they could not afford to leave their jobs. And over half of the participants shared that they were parents or had other caregiving responsibilities. This meant that restrictive tuition reimbursement policies and lack of flexible schedules, like part time or evening classes, were a barrier to upskilling.
Thank you, Afrada. So, mentorship and the role of managers. As Afrada mentioned, a lot of respondents said that supportive managers were critical in their professional development because the role of supportive managers, they encourage, they support, and they advocate for healthcare workers for professional development and for promotions. And sometimes managers may not even realize some of the opportunities that are available to their workers. Almost everyone who had been successful in an upward trajectory credited a supportive manager and or mentor for their success. However, participants also recognized when they did not have meaningful connections, they were not valued or did not have mentors to guide them. Um, More specifically, participants mentioned the lack of women in leadership roles to serve as their mentors. And so, this, in a way, was motivation for several participants to meet mentors for each other and develop that close bond that Afrada mentioned before. Next slide. And so, this is a quote here. That we got from someone within the study. And as you can see, it says the way I got to where I am is just trusting in my mentors and predecessors who saw things in me that I didn't always recognize in myself. They were a great fit for this opportunity. And I would say, sure. And it would open up a plethora of doors for me. And unfortunately, this is what we heard throughout the study, that unless you had that personal connection or someone who was advocating for you or recognized your value, that's usually the way you had heard about a lot of the opportunities that were available. Next slide.
Yes, so healthcare work environments, particularly hospitals, operated with that insider information policy that Tara mentioned, with hiring largely depending on who you know. And Black and Latina women were often outside of these informal networks, compounding the discrimination they experienced in their career journey. Women from all backgrounds mentioned men get promoted quicker and with fewer qualifications. And racial discrimination was a significant barrier, especially for Black women across multiple positions and employers. Black women had a harder time finding jobs and opportunities for advancement, and it took them longer to get promoted, if at all, than white women. Women of color seem to have a much less linear path to a BSN in particular, including more credentials earned and longer time to completion. Many Black and Latina women specifically mentioned wanting to serve communities of color and address racial disparities in their work, including wanting to go into public or community health in the future.
So, throughout the report, we've described ways in which workers, employers, and training providers don't seem to be on the same page about what is most important for healthcare career success. Workers hired often above or below their credential or license. Wages didn't seem to align with credentials and years or with their experience. What training providers said was the desired education path was not what we heard from workers. Challenge of groups working in their own way and not seeing what's happening in the other parts of the hospital system was really, really prevalent. And then also, COVID changed the healthcare worker significantly. What credentials are desired, what positions are more in demand. As we saw during COVID, those entry level positions were essential workers. And so, some hospitals were strict about who they would hire based on those credentials. And then there are differences between the perception of ideal career pathways from healthcare industry folks and the reality of navigating the maze for workers. So, we saw hospital systems who felt there's a clear pathway and we know how to get there. But there was no support for workers to get to those pathways. And a lot of times those pathways were different based on the hospital system. And so ideally you would be able to find that career pathway and move on up and keep on going and get to that nursing degree. But the reality is that it was a maze, as we say here. Navigating it is a maze.
So, after speaking with workers, our research partners, and various subject matter experts, we developed a series of recommendations, a full list of which is available in our report. But one thing we want to make note of is the need for system-wide change to address the issues we've identified. This cannot be solved without collaboration between training providers, employers, and workers. And there is a need for integrated, comprehensive solutions because one sector cannot do it alone. And because we're all connected and it's one big ecosystem. So what happens in one part is going to affect the others. And this can look like creating a task force across health systems, accrediting bodies, training program providers, government, and advocacy teams that include worker voice. The whole ecosystem has a role in addressing racial bias, underrepresentation, and equity gaps. We all know that there's been a lot of money put into healthcare workforce initiatives, but little information about how they went, either what successes or challenges that others can learn from to replicate or scale, or to try something new. So it's important that we all work together to share findings and avoid recreating the wheel unnecessarily. Additionally, decision makers need to be at the table to make meaningful change. Unfortunately, we also heard a lot about, it's just the way that it is. So it's important that people have the will to change it from the inside out and not accept the status quo. And it's important that those people that have the power to make those decisions and enact those changes are also involved in the conversation. And finally, there needs to be increased unionization across healthcare employers as a key way to address many of the issues workers shared with us. And so, like I said before, we have many recommendations in our report for employers, training providers, workforce development specialists, and philanthropy. And we can't possibly go through all of them in this presentation, but there are a few we think are particularly important. It's important to standardize job titles across health systems, create consistent and transparent transfer agreements across educational institutions for folks who do need to pivot or change schools and not have to worry about prerequisites or having to redo their educational path. And there needs to be established mentorship programs, especially for women of color in the educational space as well as in the workforce. We need to provide know your rights, salary negotiation, and understanding union contract workshops. And more recommendations and resources for workers' rights is on our website. And if you go to womenemployed.org/HCCCP, you'll be able to find our report. We have a standard report, which is a little bit more condensed and summarized. And then we have an in-depth report that goes through all of our research findings and the process for the study and our recommendations in a lot more detail. And we are happy to share today that we have piloted a project in partnership with a healthcare employer to put one of these recommendations into action, develop, clarify, and promote support for workers to upskill. So I'll let Tara take it away to share more about that.
Thanks, Afrada. So as Afrada mentioned, what Women Employed did was we took some of the recommendations out of our research and tried to apply it through a pilot program with our partners at Advocate Trinity Hospital. And it's our upskilling pilot. And the goal was to collaborate with Advocate Trinity Hospital to create a sustainable internal career pathways program for their incumbent workers that will lead to higher wages. So we developed the academic prep program to prepare those workers for the upskilling training because some of those workers probably may not have been in school for a while or may not feel academically confident. So just to build those muscles, those academic muscles that we use when we're studying and we're preparing for learning. We developed that program for them to kind of prepare to get into their training. We enrolled them in entry level workers into the upskilling training programs, and those workers were chosen by our partners at Trinity because we wanted to give them the leniency to make sure that they were choosing the best candidates for this opportunity. We provided holistic support services and resources to address some of the barriers to upskilling and advancement. We did an MOU with Trinity to make sure that they could Advocate Trinity to make sure that they could implement some of the things that we mentioned earlier that would make great workplace environment for upskilling. So maybe flexible scheduling, getting buy-in from the workers' management team and supervisors, making sure that we had support from their workforce departments, as well as their success coaches. And so all of that was pulled together to advance those entry level healthcare workers to higher level wages, making at least at the minimum $50,000 or more. And so this is kind of like the responsibilities of women employed and what we did. As you can see here on the chart, we brought together all of our partners. We made sure that we let them know that we were going to provide the technical support and the training and evaluation throughout the pilot in real time so that we can make changes as needed. We both partners realize that this is a learning experience because we are a nonprofit and we may operate very differently from a large hospital systems. And so we made sure that we are tracking our learnings as we go. They've agreed to We've agreed to make sure we connected Trinity Advocate with some of our training resources as well. And then we want to make sure that we obtain qualitative as well as quantitative feedback and data so that we can make sure that if we decide to scale this pilot, we know the necessary changes that need to be made to make it as successful as possible. And then, of course, there are responsibilities of our partners at Advocate Trinity. Next slide, please. And so they have agreed to work with us and recruit and enroll the participants for this pilot. They also completed two-week prep program that we were trained on, that we worked with consultants on. We got their input. So their team, their learning management team and professional development team was on board with that. They were able to enroll the employees, and they were also able to provide their additional wraparound supports like success coaching, tutoring, as well as tuition assistance providing prior to the training, unlike a lot of program and hospital systems who provide tuition assistance after the fact. And we know how important that is in this climate. And then they were responsible for identifying those opportunities to fill those positions once our participants are upskilled. And they've agreed to promote them into those positions that are available within their system. And participants agreed to stay in those promotions at least 2 years after completing programming. Next slide. And then this here is an example of what the participant's journey looks like. And so, of course, they're recruited, they're enrolled, they do the 2-week academic prep. In addition to the 2 week academic prep, they have access to academic resources throughout their training, so they can always go back to refreshing their medical vocabulary, medical terminology, making sure they refresh their science and biology and anything that they need to advance and be successful in their training. They have access to the academic component throughout their training. We They are going to receive wraparound supports through the things that I mentioned before, but they also have access to non-traditional academic supports. So it may be that I need, childcare, but I also need assistance with getting my brakes fixed on my car to get back and forth to training. So we provide those traditional wraparound supports, but we also provide the non-traditional wraparound supports. It could be a hotspot to make sure that I can have access to internet wherever I am, so that I can have access to my training and to my homework and to my work online. So those are some of the things that we are supporting. And then we are working with the Advocate Trinity HR department to make sure that they are on board with getting our participants prepared to apply for those upskilling positions, as well as working with their success coaches to make sure that our pilot participants have the job skills that they need to prepare for those upskilling positions, to interview for those upskilling positions, to make sure that their resumes are updated and on point. And so those are the things that we're doing in compilation with this whole pilot, that we hope to address some of the recommendations that were mentioned earlier. And so we want to open the opportunity for conversation, communication. We do have some questions that are in the chat. And so we would like to address some of your questions. And also, as we mentioned earlier, if you have questions and you want to come off mute to ask your question, just raise your hand and Mikal can definitely take you off mute. And so the first question in the Q&A we have, it says, it's a long question, so it says, just curious. Rory says, did any of the employers that you might have consulted or interviewed for your study, hospitals, medical centers, etc., did any of the employers have or utilize registered apprenticeships? So that's the first part to this question. So I'll let Afrada answer that because she is the research person that worked closely with those programs and that research.
Really great question. Thanks for asking it. So yes, there were employers that we worked with that did use models like registered apprenticeship. So they had models where they would have folks um, studying. Specifically, there was one employer, they were a clinic and they hired medical assistants. So they had a partnership with a training provider where the participant would be learning and getting that theory-based education while also working full-time at the clinic. Um, so similar to other apprenticeship models where they're able to put what they're learning into practice right away and get that support and get that hands-on training in the healthcare setting. And then they also had an agreement with the student that they would hire them and they could work there for at least 2 years in order while also getting tuition benefits. So the employer would cover their tuition costs for getting that training, and then the student would then get opportunity for full-time employment after they complete. So that was a model that came up, and then there are others that did similar types of things. I do want to clarify that our study was primarily with workers. And so although we consulted or we met with subject matter experts and employers around their thoughts on various upskilling models or workforce initiatives, they varied across the board.
The second part to Rory's question was, do healthcare systems, employers, in our experience, seem open to implementing apprenticeships for their workers to advance, or do some seem hesitant or even adverse to the idea? I can tell you on the programmatic side that working with Advocate Trinity, we are aware that they have several apprenticeship type programs that are going on in partnership with other community based organizations. So I know that they are very open to that. And also in finding and doing this research, we found there are several hospital systems that are very open to apprenticeships here in the Chicagoland area. Now, we unfortunately weren't able to kind of reach people outside of the area. So we are not sure what's going on maybe in Central State. We know we have a lot of people here in Northern Illinois and Central. So we would love to hear from you if you all think that you all know of any programs in your area that are open to apprenticeships, who may be open to some sort of model to do this type of pilot. And Victoria, I hope that answers your question for Rory. If not, please elaborate in the chat. Rory, thank you for that question. And then Victoria says, my question has to do with the 2-week academic prep program. Who has curriculum? Is this only for the employed by this hospital? I'd be interested in this curriculum for a full program that I will be teaching. So right now, the 2-week academic prep program was built in partnership with one of our consultants. And we built that program strictly for the pilot. So unfortunately, it is not available right now. Not saying that it won't be in the future, only because this is the first cohort of the pilot, and the plan is to expand the pilot with our current partner, Advocate Trinity, and maybe with the future hospital system. And so as we scale, this is a very new, like we are really in the infant stages of the pilot. So as we do scale and as we continue to make adjustments as needed and learn from the pilot, we probably will eventually probably release the academic prep and what we did. And of course, that would be in agreement with our partners who helped us create that. So, but Victoria, just on a caveat, if you're interested in what that may look like or how that was created and some of the resources we use, you can definitely reach out to us, and we will be happy to have that conversation with you on some of the background on the creation of the academic prep. And I just answered that, Victoria. So yeah, so reach out to us and we can definitely connect with you and give you some resources for that. Any other questions?
Thank you for your questions. Any other questions, or even if you want to say it in the chat or come off mute to share any of your reactions to what we shared today? Was it surprising? Was it to be expected? Any way that you think you can, you know, our findings are applicable to your work? Yes, Victoria, we do acknowledge, and that is one of the limitations of the study, that our sample size is relatively small. But we found it to be valuable that this was a qualitative research study to really get the worker voice in sharing their experiences of what it's like to navigate these education and workforce ecosystems. And because we couldn't find that data, or we couldn't find research like it prior. So
And we definitely tried to get a larger sample.
yes.
Yes.
It looks like Carrie has their hand up. Are you okay if we take that
Sure.
question? Awesome. Carrie, you should be good to go to come off of mute.
Yes, I think I am now. I just had a question about, it's really a fascinating study, but I had a question about, because I know this was focused on the employees and the employers, but did you assess or ask anybody about their academic backgrounds? I'm finding that students who have, who don't have a strong background in math and science, whether it was high school 5 years ago or 20 years ago really struggle moving along in those, those higher levels or those stronger credentials? And what support are we giving them, or would your pilot be giving them in those areas?
Yeah. So as we mentioned, we did an academic prep program before
Okay.
all of our participants actually enrolled in their upskilling training. So whether they were going into surgical technology,
Mhm.
imaging, whatever the higher level role was, we had them enroll in the academic prep portion. And what that entailed was a lot of math and a lot of science
It
and a
was.
lot of refreshing of the math and the science and the medical terminology. And so they had an opportunity to kind of use that for the 2 weeks prior to starting their training, or up until the time they enrolled in their training, and they continue to have access to those resources throughout the term of the pilot. So they can always go back to those resources and refresh themselves. They can use those academic resources as tools if they need additional support as they're going through their training, along with tutoring that's offered to them as well.
Oh, that is fantastic. I'd love to see like their testimonials and stuff, just because I think a lot of it, and I don't want to dominate here, but a lot of it is the confidence level.
Yes.
Right? So, yeah,
Yes,
great.
and
Thank you.
myself, as you may have noticed,
Mm.
Afrada is our research person. She's the research background. I'm the program background, and
Sure.
so a lot of the development in the pilot and the programming, um, kind of what we wanted to definitely address that.
Mm.
With my background in education and adult education and things like that, I definitely knew and felt there was a need to make sure that we were able to build the academic confidence of the participants before even uh, telling them, hey, let's put you in this training at a college or, wherever, and say, jump in and we're going to upskill you and assure that they are going to complete the program. Because as we all know, if you don't have the academic confidence, you can start something, but you can easily say, hey, not right now, I can't do this. And so we thought that was a very important piece. Thank you, Carrie, for
Of
acknowledging
course.
that.
Thank you.
Mhm.
As it relates to the research participants, many of our research, so the folks that we were speaking to are folks that had already kind of been made it through their educational paths to get into healthcare and were on their at a later point in their healthcare careers, right? So we weren't so just with that context in mind, and they did share with us not they were not all traditional students. They were, and that was a large finding, a theme in our study, that it was people that maybe didn't finish high school the first time and had to go back, or maybe they had a larger gap between high school and getting into their associate's program or bachelor's, or maybe they were established in another career and then they made a pivot. And so they did share like needing additional resources and having to take additional classes to build up their like educational background in math and science, and even just getting the prerequisites completed. Some folks unfortunately timed out, so when they were trying to transfer their transcripts, they weren't accepted, so they have to go back and retake some courses. So we did speak to folks who had that experience. We also have in our research report a series of kind of best practices that we identified from the partners that we spoke to, or subject matter experts that shared with us some ways that they have been able to provide that additional support. There was one education provider that provided a lot of wraparound support and tutoring and test prep and study guides to meet the needs of their participants, which were largely non-traditional students, mothers. And so we have that as an example of kind of what our best practices or ways to support folks who are interested in a healthcare career. Um, and childcare was really big, right? So not just having childcare that meets people's needs in terms of what their schedules are. So if they need to take evening classes and they need evening childcare, then that's an accommodation that one of our education partners provided, which we thought was really cool. So I I hope that answers your question. So I thank you all so much for your questions and your input. If there are any more, please keep them coming. We are ending a little bit early, so we're happy to give you all more back some time in your very busy schedules, I'm sure. But on your screen, you'll see that we encourage you to please go on our website, womenemployed.org/HCCP, to access our report. And we have on there our contact information. So if you have any questions for myself and Tara after the fact, or if you'd like to schedule a follow-up conversation or anything like that, please feel free to email us at careerpathways@womenemployed.org. And that link and that email is in the chat for you. And then lastly, you can stay in touch with Women Employed and get to know us more and what we're up to on our website and our various social media platforms. Thank you all so much for attending.
Yes, thank you guys all for coming out today for our Workforce Wednesday webinar. If you, in the next 24 to 48 hours, be on the lookout for an email that'll just have a survey just to get feedback on how this session went and all of the great things, as well as if you want to go and look at those materials, the recording, that'll be up in the next 24 to 48 hours. Victoria, you did have a question of do we get PD for this session? If you want to email me, I will look into that and see what it looks like. I'm not sure exactly how it would work. But yes, contact me. I will put my email in the chat real quick. Other than that, have a wonderful day, everyone. Thank you all for coming out.
Thank you, everyone.
And Victoria, there is my email. That was awesome. I enjoyed it very much so.
Yeah, went really well.
Went quicker than I thought it would.
Yeah, I see there's
That's
still 12
okay.
participants on. Is it better if we end the webinar and then start it up again?
Yeah, at least the
I wanted
recording.
to.
Yes, we can do that. Absolutely. I will end it and then have us hop back on.
Okay.
Sounds good. Thank you.